Hello, my name is Kayla Hersey and I am a public health nurse. I will be speaking to you today about a crisis in the state of Louisiana that deserves your attention. Infant mortality is a term many think of as being in the past, certainly not a problem in the United States. However, recent infant mortality rates have heavily burdened the state of Louisiana. 15% of births in Louisiana are preterm, and the survival rates are incredibly low. 8.9 out of these 1,000 preterm babies will pass before making it to their first birthday. Infant mortality is mostly due to infections, lack of care due to cost, and lack of warmth, basic rights that all infants should receive. Negative impacts due to infant mortality affect the infant as well as the families, as they may need to deal with the loss of a child or a lifetime of care due to these disabilities. Of these preterm babies, mothers of African American descent are the most greatly affected. Women are often unaware of the risk factors that are associated with preterm birth, which include women over the age of 40, women who smoke, multiple births at one time, such as twins or triplets, birth spacing less than 18 months, obesity, and lack of health insurance, often due to low socioeconomic status. This leads me to my problem statement. African American women are at the greatest risk for having premature babies and infant mortality in Louisiana, which negatively impacts the remainder of the child's life, including developmental delay, respiratory problems, vision impairments, and hearing impairments. In order to better assess this problem, it is helpful for us to look at the social ecological model. This model will allow us to understand the relationship between personal and environmental factors in order to determine why infant mortality is occurring and what ways we may be able to stop this. First, the individual level is what one's own beliefs are, as well as their knowledge. Women may not know that they are at risk for premature births or infant mortality. My role as the public health nurse will be to change the individual's belief and knowledge by educating them about the known risk factors and what they can do to prevent or change their habits. I may then become part of the interpersonal level, as I will have a relationship with these women. The positive relationship between myself and the individual may influence the women to receive proper care, participate in family planning programs, and frequently visit an OBGYN, which are all part of the organizational level. At the community level, I can be the forefront in media representation. I will be able to speak on behalf of the medical aspect of infant mortality, as well as the family aspect, as I am one of the primary contacts for both of these individuals. Lastly, I am a vital piece at the policy level of the social ecological model. I will bridge the gap between the public and the government in order to educate and discuss the needs of each of these two parties. I will also be able to lobby for the public and describe specific details that are required, such as more funding and more clinics in the urban areas, much like what I am doing today. Lastly, as the public health nurse, I can also play a role in partnering with organizations like the March of Dimes Foundation. Now that we have an understanding of why this public health crisis is affecting the state, it is time that myself, the nurse, and you, the director of the Louisiana Bureau of Health, act. The best way to create interventions that will target our population is via successful evidence-based programs. Evidence suggests that increasing the duration of paid maternity leave can lower infant mortality rates in low and middle income countries. We can adapt this evidence-based intervention to particularly target small businesses as well as the government in the state. With your support, we will be able to lobby for paid maternity leave to all employees. The goal of the second intervention will be to recruit individuals to participate in the educational classes in order to increase their knowledge and potentially reduce infant mortality rates. We will target those who are at risk for infant mortality or preterm births at 2-hour sessions 2 times a week for 8 weeks. Lastly, we can use the trans-theoretical model and self-efficacy theory in order to promote a behavior change. In this case, the behavior change would be a risk factor for infant mortality, such as weight loss or smoking cessation. As the nurse, in order to achieve these interventions, I will need a center where education can begin. The meeting place for all 3 of these interventions will be somewhere that all are welcome and can hold the appropriate number of people. This meeting place will also need to be easily accessible for all. In addition to the right location, these interventions will only be successful if all of those involved are properly educated. The staffing should include health educators, nurses, doctors, or other practitioners, and a public health official who will be responsible for funding. As part of the intervention process, it is important that we are able to effectively evaluate, monitor, and measure the success of our programs. As described, the goal of the first intervention is to ensure that all women in Louisiana, regardless of socioeconomic status, are entitled to paid maternity leave. However, we will need to start with small businesses first. In order to assess if the intervention has been successful in the population, maternal and child health knowledge should be evaluated through surveys. We will measure the baseline statuses of individuals that have paid maternity leave compared to those that don't. Post-intervention data will be collected via surveys to assess if employers are offering paid maternity leave. The goal of the second intervention will be to recruit individuals to participate in the education classes in order to increase their knowledge and potentially reduce infant mortality rates. We will target those who are at risk for infant mortality or preterm births. Baseline data will be collected at these classes. To start, information will be collected on women's knowledge of risk factors for infant mortality and their basic understanding of maternal and child health. Post-intervention data will be collected using the same survey in order to assess if their knowledge has increased. Lastly, the target or goal of the trans-theoretical model and self-efficacy intervention will be to change behaviors in women who are at risk for infant mortality, such as smokers or obese women. The way to measure this intervention will be to assess for behavioral changes, for example, weight loss and smoking cessation. Baseline data for weight and smoking status will be collected. Information regarding education about smoking and weight loss will be documented prior to learning in order to determine the effectiveness of the intervention. Post-intervention data will be collected in the same way that baseline data was in order to assess for weight loss or smoking cessation. Lastly, we must consider and anticipate the potential barriers and challenges that come along with these interventions. An important aspect to consider during the paid maternity leave intervention will be job status. Women may feel they cannot take the same amount of time off of work after giving birth due to the demand of their job. The government, local businesses, and organizations will be needed to help support these women who do not have paid maternity leave. Next, an important aspect to consider during the evaluation will be to make the program more targeted towards the audience. It is important to target specific communities and adapt your intervention so that cultural competency is considered. We must treat everyone equally on the same knowledge base level. Lastly, during the trans-theoretical model intervention, we must be cognizant of one's self-efficacy. Everyone is different, and therefore the intervention needs to be direct and adaptable towards the needs of the audience. The intervention also needs to be little or no cost so that all who need help can afford it. This logic model is a summary of the proposed interventions in order to clearly show what each intervention will do and what our ultimate goal is. This model is created so that we can ask ourselves, if we do something, then we will get our described result across the board. For example, by having state officials, small business owners, staff to write, institute, and support the policy of paid maternity leave to all women, as well as support from the community via protests and lobbying, we can show state officials and business owners through employee satisfaction surveys and statistics that employees are more likely to return to work if offered paid maternity leave. This will change the number of businesses that offer paid maternity leave, and with the support of the community, local businesses, and proper funding, paid maternity leave will then be offered to employees. Lastly, the ultimate goal will be improved is infant mortality rates. We see the same pattern for the next two interventions as well. We will need to develop curriculum, have a place to teach classes, as well as staff to teach and the appropriate funding. If we have all of those pieces, we are then able to educate regarding risk factors, give resources, provide ways to quit smoking, and ways to lose weight. After we do this, we are able to see behavioral changes as well as increased baseline knowledge, all with the same result of reducing infant mortality rates. Now that I have educated you on the problem, the risk factors, the interventions, and the proper solution, it is time for all of us to take action. With your help, we will be able to receive funding for these interventions, as well as properly trained staff to get the job done. As the Director of the Health Bureau, I ask that you support our plan and interventions. and hope that you will provide a place and staff to do so. I look forward to working with you. Thank you.